All right, so in the lectures this week, we've talked not only about what vaccines are, but also how they're distributed and how they're used in populations. And Marcel presented some information about targeted vaccination and the idea of vaccinating those individuals that are most communicative, the potential super spreaders, as an idealized strategy. And there's been a lot of discussion in the forums about how wonderfully intuitive that is, and why on earth we don't just do it all the time. Why isn't it just that simple, just to find the most popular individuals and stick them in the arm? You must have something to say about this. From
if you know how to find those people,
exactly.
That would be wonderful.
Right.
Most people don't like to be tracked. I mean, we put little trackers on animals at points in time to find out who's migrating and who's interacting with whom, but unless we're going to use all your cell phones, which some people are, we won't have a very good sense of who's going to be interacting with the most people and how well people can self-report on it. And if we're going to use Facebook, then that doesn't mean anything because everybody has thousands of friends. And it may mean they actually aren't interacting with any of them. They're all having virtual contact. So
right. So I think we oftentimes think that the social networks that we see online or with phones or something like that, right? Or even some of the famous diary studies where people carry around a piece of paper and write down how many people they chat with during the course of the day. We sort of presume that necessarily translates into those individuals that are going to transmit the most, right? But it's not. It really is just a proxy measure, and so our ability to target is only as good as that measure is as a proxy of transmission.
But I think it's a really interesting question because there's two ways to look at it.
Yes.
One is where you want to prioritize giving the vaccine to the people most at risk for the infectious disease, and the other one is the one where you want to target the people at most at risk of spreading the disease. And I think it was a really interesting discussion about that panned out during the swine pandemic, influenza swine pandemic, where the understanding at the time was that really transmission in schools are the most important amplifier of infection in the community. So that would tend to suggest that vaccination should be done in schools. But of course, the people that are at risk of dying from this thing, at least traditionally for influenza, are the very old or the very young. And so typically from a disease control point of view, you maybe want to, well, the discussion is to protect against disease or protect against spread.
Well, I've got a personal experience here because I had a very nasty influenza infection, which I know I picked up in an Italian disco. So I think we should go to Italian discos and vaccinate everybody in those.
So are those necessarily mutually exclusive though? Because you should be able to do both. And indeed, if the goal is to try and stop spread, then you target individuals who are more likely to be the super spreaders, as well as in areas such as discos, where the super spreaders might actually be spreading more effectively.
Yeah.
Beacon case.
I think the issue though is if you have a limited amount of vaccine, and that was what spurred the modeling. I think.
And I think
some of
the nice things came out of some of that studies was that you could actually have fewer diseased individuals, not by protecting those individuals, but by getting at the spreaders. And so you have a better overall public health outcome, not through the direct effect of vaccination, but through the transmission blocking.
But with Ebola at the moment, we're crying out to have a vaccine for the health workers because so many of them are being exposed, and it's such a disaster.
And that was definitely the case in for the swine flu, where because the initial vaccine was really, really limited, and clearly the health workers, certainly in the West, were vaccinated first. And I guess that serves the dual purpose because they're both the ones that were likely to be exposed the most. But also because they're in a hospital setting, hospitals are also typically a breeding ground for infection. So I guess that's kind of where you get a little bit of both.
But it looks like, I mean, at least some of the models that I saw, the reason the schools were showing up is because that's where they saw the greatest mixing of the different groups, where they saw the adults mixing with kids who mixed different parts of the neighborhoods together. I'm not sure as we start seeing things like Ebola change the interaction patterns of the communities that those models then maintain. Right, so the models that we have of how people would normally act on their day-to-day basis may have no more validity as soon as we start reshaping the system and they're all mixing at the healthcare centers because they're all trying to figure out where everybody is, and so we might need to have dynamic, adaptive systems that continue to monitor how even just traffic patterns are changing.
Right.
So
Right. And we can do it as simply as that, just monitoring traffic patterns.
Well, I was going to say, it raises an interesting point about whether we should be targeting the individuals that do the most spreading or the places or the locations
Right.
where the most spreading is happening.
Right.
Because I mean, from a practical standpoint, it may be easier to identify places where lots of interaction is happening and then vaccinate all the people there. So you're not being particularly selective and you're not singling individuals out for high-risk behavior necessarily, and potentially you might get more buy-in in those kinds of situations. Right?
So a good example of that was some work that was done on HIV, and you may have given me the paper, Rachel, because it was about using antiretrovirals in southern Africa, and they had done the modelling and said this is the group that we need to target. And when they tried to do it, they had a big response against it because it was considered unfair. Because they only had a limited amount of drugs, and it was going to this group to try and stop onward transmission. And they were saying this is unfair because it should be going to the people who are sick.
Yeah, and at the end of the day, you need to get community buy-in to develop any of these campaigns, to distribute these vaccines, and the perception of inequality can actually be a really strong barrier to community level adoption of these programs.
It's an interesting sort of, I guess, just to step back. In the case of humans, these are all extremely important questions. In the case of animals, you could sort of also ask the question, so how could we address this if you were to identify super spreader animals that were really the ones that were truly transmitting? It's actually, as Rachel suggested, a non-trivial task to identify those quote-unquote highest risk groups. But if even within the animal systems. And so, in fact, these blanket strategies end up being the most widely adopted ones.
But if you look at something like foot and mouth, which gets into several different domestic animals, we know that when it gets into pigs, it's just producing these huge plumes of viruses. When in sheep and cows, it's less transmissible. So the first thing you should do is close down your pigs and make sure they're not transmitting. And then you close down, is it cows next or sheep next?
Yes, and you have these ring vaccination strategies, which are sort of also, in a sense, rather blanket, because you're sort of saying you're the most susceptible individuals and you're the most likely to be transmitting after that. And then how far out you go with the ring really depends on how quickly the disease spreads and also the movement patterns between those. And so in the end, you sort of almost start to say, each case is going to be different. Every situation is going to be different. Unless you have models that are able to predict exactly how that's going to spread out, you're guessing, and every time it's an experiment. So rather than that, go ahead, do the whole lot.
Did you always have to make the decision on the data you've got, the best data?
Absolutely.